Hi, my name is Cabrinha. I am a licensed acupuncturist and herbalist at Balance Restored, where I work with my colleagues Susan Fox and Karen Reynolds. And today I am interviewing Willie Victor, owner and nutritionist at Essentials for Health. We are in Mill Valley, and today we're talking to Willie about how she's helped so many of our fertility clients. So Willie, my first question for you is a question that a lot of my patients have asked me when I'm referring them to you. How does diet impact fertility?
Okay, that's a really good question. First of all, I think that fertility is impacted from inflammation. And inflammation is something that starts in the gut area, and lots of things can affect that. It can be medications they're on, it can be foods that they're eating, chemicals that they're exposed to, their gut bacteria. Lots of things can cause inflammation in the gut. And inflammation doesn't just stay there. It goes throughout the body, and it can also go into the reproductive area. When the reproductive area is inflamed, then it's harder to get pregnant, hold a pregnancy, and that sort of thing.
So Willie, you just mentioned that one of the things that can impact inflammation in the body is food. Why do you test for food sensitivity when you're working with a woman who wants to conceive?
Well, there's lots of different reasons. One, we have done a lot of studies, and that celiac disease, which is a definite response to the gluten protein in food, can be a part of the reason that a woman is having a hard time conceiving. So that can be one thing. But food in itself, what happens in the gut area is that the gut, when there's a lot of foods that are causing inflammation, the gut becomes permeable, and you start having proteins leak through the gut lining, and it starts a response to the immune system. And when the immune system starts responding to these proteins that have leaked through, then what happens is inflammation starts to occur. And then that's that inflammation that I mentioned before that can cause an inflammatory response that goes through the entire body and can then affect the woman getting pregnant.
And Willie, could you mention just a few types of patients that you commonly see in the clinic?
Okay. Most of the people that come in that are having fertility issues have already come to us after they have already tried IUIs, IVFs, maybe multiple times. And a lot of those clients, the reason that those have not taken, what we've found is that the inflammation is there. And once we've cleared the inflammation, a lot of these have been successful. Some have had to go back and do maybe an IUI, or they've had an IVF. Some have not had to do that at all. They've become pregnant on their own. We've had clients that were recommended to have egg donors, and they have gotten pregnant on their own after we cleared the inflammation. We've had people who were recommended to go back and have an IVF, and before the IVF cycle happened, they actually got pregnant. And so we've had women in their 40s. We've actually had one woman at 44 that have conceived successfully and have had babies.
Yeah, and have brought them by.
Yes, they have.
So I think a lot of people would think of going to a nutritionist if they had digestive issues or if they want to lose weight. How would someone who's trying to conceive think about coming to see you? What other things might they be experiencing that they would kind of light bulb go off and say, okay, I would probably benefit a lot from a program like yours?
Okay. Again, a lot of people have pain in their body, and pain in itself can cause inflammation. It raises cortisol levels, which can lead to inflammation issues or gut issues, which then lead to all the things that we've talked about. Another thing is some people have already been diagnosed with autoimmune diseases, and so therefore their immune system is out of balance. And what we work on with nutrition is to bring that immune system into balance so that there are less flare-ups from their autoimmune, and that's when they're able to conceive.
So I think this relationship between the immune system and fertility is fascinating. And usually when we think about treating a woman for fertility, we're so focused on the ovaries and the uterus that we can forget about all the other symptoms, or rather systems. What is the relationship between the immune system and the reproductive system?
Well, I think again, it really comes down to that inflammation, because when the body's inflamed and the immune system is being affected, that what happens is there's a lot of markers, cytokine markers and other things that are offset. And when that occurs, then it makes it harder for the woman to get pregnant. And so what we're doing always is we're looking for how can we reduce that inflammation in the body? What can we do to bring that immune system more into a balanced pattern so that she has a better opportunity to conceive?
And how does healing the gut specifically impact the immune system?
When the gut is healed, you're not going to have all of these proteins leaking through, and those proteins, when they leak through, is what triggers the immune system, because it sees those proteins no different than a virus, and so the body is actually trying to get rid of them. So when the gut is healed, the proteins aren't leaking through, and when the proteins don't leak through, then the body stops fighting those proteins and the immune system settles down.
So, Willie, how soon should a woman start with you before she's trying to conceive?
Well, women usually who want to conceive are very anxious to get things going. But what we like to do is we really like to do a cleansing, especially if they've been through an IVF or an IUI cycle or several of them. One of the things we like to do is clear some of those hormones out of the body. And so we use mild detoxing, and I do say mild because I don't believe in heavy detoxes, but we use a mild detox to clear some of the hormones. And then in order to get the gut really healed, it takes 2 to 3 months. And so I like to have that time, so we can detox, get the liver in good condition, because that's what takes a lot of the toxins out of the body. The other thing I like to do is really get the gut healed so we're not leaking all these proteins and creating inflammation. And that again takes 2 or 3 months, especially if they're real committed to the program. We can get this done in that time. And that's when we seem to have the most success. Some people are anxious and don't want to wait that long, but I find that if they're willing to give us that time and go through a full 3-month program, we really do have a lot better success.
So you mentioned that you do a liver detox and then eliminate foods and heal the gut. What is your roadmap to deciding which foods to eliminate?
Well, a lot of people that when they work with food elimination, they just pick out certain foods. Most of us have heard gluten and dairy and those things cause sensitivities. But what I have found is that it's not just allergies, it's more of what is actually leaking through the gut that creates these hypersensitivities. And so what I do is I do a test that's scientifically based, and we check for 200 foods, different chemicals, molds, food additives. All those different things are part of the picture. It's not just about food, it's the whole picture. And by eliminating all of those different categories, we find that we get the gut to calm down a lot faster, and then we can have success a lot better success.
And I have found that too, through using acupuncture and herbal therapy. I've had a lot of success, but there are patients who have just gone on too long without success, and when I've referred them to you, it's only a matter of a few months in a lot of cases, and right now, most cases. So your program has been a huge benefit to our patients here with acupuncture, so thank you.
Thank you.
Yeah.